Hi, everybody. So my name is Tyler Fowler, and I am a third year at ASCOM and the current chair of the Arizona Emergency Medicine Medical Student Council. I want to thank you all for coming to our event today. And I want to preemptively thank all of our program admin for joining us for the panel and breakout sessions, and then Dr. Shah for coming to give the keynote address. This event will be recorded, so if you don't want your image shown in the recording, you may keep your camera off. We will be using the spotlight feature of Zoom, so if you put it in speaker view, then you can just see the panelists and lecturers when they're talking. Also, you can change your name by clicking on the three dots at the top right corner of your picture. You can put something like your name, year, and school, or something to that effect. If you have any questions throughout the conference, just private message one of the council members. In our names, we all have our positions. And then we're gonna go ahead and kick things off with a talk from Dr. Shah. So Dr. Shah is a member of the Arizona House of Representatives. He's representing District 24 for the past 2 years. He completed medical school at Northwestern University and then a master's in public health at UC Berkeley. He completed an EM residency in New York City and began teaching students and residents at Mount Sinai, and later went on to complete a fellowship in sports medicine at U of A and work with the NFL. He also does CrossFit and flies small airplanes. So without further ado, please welcome Dr. Shah.
Thank you. Thanks everybody for having me. I'm honored to kick off this important event. I hope it's really productive for you guys and you guys are able to get all your questions answered and make a really good decision. It's a pretty important decision. You heard a little bit about me. I've been in Arizona now for about 9 years, and it's been wonderful being here. One of the things that I love so much about emergency medicine is the breadth of experience that you can get in this specialty. I've been very, very fortunate. I applaud all of you for choosing a career in emergency medicine, first of all, because I mean, picking this specialty was one of the best decisions I've ever made in my life. I've been able to be there for patients during some of their toughest times. As a special point of pride, we are a safety net for people. We take care of anybody, anytime, no matter where they're from, what they look like, or whether they can pay or not. There are a few specialties that can go on that can say that. We routinely get to save lives and handle these acute situations, and that's also something that you don't see in a lot of specialties. We cover a large breadth of material, and we prepare you to handle anything that life will throw at you, that reality will throw at you. It's a lot more practical and dabbles less in the esoteric, even though once in a while you do see things like that. We are good at knowing what I realize about emergency physicians compared to a lot of others out there is that we know when to act, we know when to think. And we know the difference between those situations and who to prioritize. Those are a lot of great life skills that apply to a lot of things beyond just medicine. But it's a wonderful specialty that has just given me back. The more you put into anything, the more it gives you back. And this specialty and this profession has given me so much in terms of a fulfilling life. So congratulations to all of you for picking this and pursuing a career. I'm sure you guys all know that the specialty is fairly young, as it was accredited, I believe, in 1989, first by the American Board of Medical Specialties. And over the last few generations, much has changed. When I was in residency, you know, there was an older generation, and they would talk to us about what it was like in the older times. It was a ragtag group of cowboys and cowgirls, as they would call themselves. And they would just have to innovate and find their way through things, through tough situations, and just kind of figure stuff out. And we have now morphed in 2021 into a very, very mature specialty. We have journals that are top tier, that are very prestigious, and it's very hard to publish in those journals now. We have these specialty societies that are very, very large, including one just directed at academics, others directed at various, one that, you know, is very, very large, ACEP, that covers just about everybody. And then we have one specifically looking out for individual emergency physicians in AAEM, which holds a special place in my heart, and a number of board eligible fellowships. So you can find yourself so many different experiences that I talked about. I completed my residency training at a county institution, and everybody else says, oh, wow. So it was Lincoln in the Bronx, busiest trauma center in New York City, knives and guns and all kinds of weird stuff coming in through the door all the time. That was one type of experience. A lot of my colleagues finished at some kind of academic center, right? Where it was a lot of people with fancy college educations and maybe a little bit of snobbery and that whole attitude that goes around it. And it's also a very different type of experience. So I did that for a little while too, right? In New York. And it's just a very different thing. People look, think, and focus on very different things within the specialty itself. And then finally, over the last few years, it's been a lot of community and rural medicine that I've been doing. And it's very interesting because a lot of times I end up being the only physician in the hospital. And that's also a unique and different experience because you do have to just kind of figure it out. Sometimes running all over the hospital doing codes. And so all of those things will just make you sharper, give you more experience and season you as a physician. So it certainly gives us a lot of opportunity for a great life. So, and then I would be remiss to mention that some of us have really gone on to become deans at medical schools, administrators at hospitals, so moving up the chain, becoming CMOs and CEOs of big hospital chains. And why is that? Because emergency physicians have to work with almost every other specialty out there. So we connect with them, we talk with them, we understand their disease processes, and we understand ultimately how they think too. So having somebody that knows the various languages that are spoken across the hospital also helps us to be that physician that can operate in the systems-based environment and therefore be a leader later in life. So these are all wonderful things. My goal today really is to give you some guidance in choosing a residency program. You know, I think the thing that I worried about, and I still hear many medical students worrying about, is will I be well trained clinically? And the answer overwhelmingly to that question is yes. Pretty much wherever you go, as long as it's accredited, I think you will come out well trained clinically. I used to worry about, will I get procedures? Will I run enough codes? All those kinds of things. I think that to me is less of a concern as long as the program is accredited. But where you do have a little bit of a choice is figuring out what kind of a setting you want to practice in. So these settings that I mentioned do have a different set of experiences associated with them, and it's a matter of fit, and it's a matter of where you see your career going afterward. Now, like mine, you can end up doing a whole lot of others, like a lot of stuff in all different ways. But again, the county program versus the academic program versus the community program, that's something that you have to kind of think about depending on how you think your life is going to go and what your interests are after residency. A few of the questions that you always want to ask: are the residents happy? Right? You know, residents are always tired. Residents complain a lot. I know because I complained a lot, and Anna will tell you, Dr. Waterbrook will tell you that as well. But there's a difference between complaining about something just because you're tired and you're learning a lot and you're fatigued and you're getting a lot of clinical experience in a short amount of time, which is good for you, versus some other types of complaints that are very legitimate that perhaps you know don't make for a good program. There are very few, I think, in the country programs that just really aren't that great. But those are really few and far between, and the issues that come in with those kinds of programs have to do with adequacy of supervision, for example. All right. So you do see that sometimes. I mean, if the attendings are just absent all the time, again, this is a very rare situation, but if the attendings are just absent all the time, that doesn't speak well. You know, you have to ask, like, there are requirements for the number of core faculty members, as well as the program, the officers. So they have to have a program director, they have to have a research director. Usually these days they'll have an ultrasound director, and they'll also have a program coordinator that are all, you know, have to be within the scope of the program. So you know, administratively they do have to run a good program for you, but they have to be responsive to your concerns. Ask yourself, what do the residents do after graduation? Where are they headed? What kind of opportunities do they have? I think those are good questions to ask. I think most residency programs will take a lot of pride in where their graduates ended up afterward and continue to follow them. Certainly I have an alumni group from where I did residency, and I still keep in touch with a lot of my colleagues. And they've done just a variety of different things. The breadth, finally, the last thing is like kind of the breadth of off-service rotations. You know, not like where I trained way back when, we had no access to sports medicine. I didn't really know that would be something I would be interested in. And it was really interesting because I went to the University of Arizona and I saw that all these folks had access to the sports medicine program. Of course, U of A is a Division I athletics program, and so there's a lot of opportunity there, and the residents could do that as an elective, but that was never offered there, and I never would have known that was a career path that I potentially could follow. So that was good. I think I'm not telling you anything you guys don't know. I think you'll when you get into these interviews, just you'll interview them back, you'll ask them these questions, and just try to get a feel. Hopefully you'll take some of the residents and go out to lunch when the attendings are not around, so they can give you a real sense of what is actually going on in the program. I know we were encouraged to do that. Everybody encouraged us to do that, and we did that as interviewees. So, you know, that's good. For the program directors on this call, I hope I've not just made your lives all that tougher by setting these folks up to ask you really, really tough questions. So there's that. I finally wanted to touch on a topic that the organizers of this meeting had wanted me to go into. A little bit of a new topic, and maybe even a little bit of a sensitive topic that we've been hearing about in the emergency medicine community over the last year or so, since the COVID-19 crisis came up. And that is, what is going on with the emergency medicine job market out there? How are our residents going to do over the next 5 to 10 years? Are there opportunities available after graduation? And what, if anything, are we doing about this? So I am very fortunate in that my career mentor, who I met while I was in residency, is currently the president of the American Academy of Emergency Medicine. So her name is Dr. Lisa Moreno-Walton. And I'm proud to consider her one of my closest friends, as well as my lifetime career mentor. And we had, you know, because your organizers at this meeting asked me this question, I went straight to her and asked her and got a big download for all of you as to what do we think about what's going on here. Many of you have heard that over the last year during COVID, we had a drop in volume. And because we had a lot of drop in volume, we had emergency physicians across the country getting furloughed or not being able to pick up shifts, and really just generally a decreased demand situation. Many people think that is a temporary thing. We are starting to see some of our volumes return. Certainly in Arizona, that's kind of been the case. And what that means for the future is kind of yet to be unseen. But there are some trends and some factors that were identified by a study done by AAEM. They've actually published it in the Journal of Emergency Medicine. There was a gentleman by the name of Dr. Reiter. And basically what he said was that over the next 10 years, up to getting to about 2030, they project that we may be in a 20 to 30% oversupply situation. So that's kind of the bad news. What are the causes of something like this? Well, there are a few things. Is that in the last 4 years, 44 new residency programs have come up throughout the United States, right? These residency programs obviously will produce a lot of new residents, and a lot of new grads will go out into the market. So oversupply is a problem when we have new grads, and for this year, I'm sorry, I don't want to sound so doom and gloom, but over this last year, we did see, our national specialty organizations did start to see that new graduates had a tougher time getting jobs this year as compared to the years before. And when there isn't as much demand and the market doesn't have as much slack in it, then you have situations where you might start to see salary decrease. So this year we did actually nationally, apparently we did see a salary decrease. Over the years preceding, we had never really ever seen a salary decrease before. We had always kind of seen a steady march and an increase in emergency medicine salaries across the country. In the South and the West here, we're generally at a higher salary range, and the Northeast is usually sort of where the lowest salaries are across the country. But as a trend, that's kind of what was happening. The other somewhat touchy point is the idea of advanced practitioners, such as PAs and NPs. In some jurisdictions, we're seeing attending shifts dropping and PA coverage expanding in a very different model of care. That didn't really used to be nationally, and it's kind of moving into that as we start to see some of these groups trying to save on costs, right? Something certainly of concern to our national organizations. And this is all the situation that's today. And the good news is that both of our specialty societies are laser focused on fixing these problems and doing something to make sure that we don't end up in a situation 5 years from now, which doesn't lead to great outcomes for emergency physicians and for us, for our specialty to continue to thrive. So they first went to the anesthesia folks. Believe it or not, they had a very similar situation going on where they were facing something like this, and oversupply problems. And the anesthesia folks did recover nicely. And some of the solutions that they put through were very interesting and sort of where we might be headed in emergency medicine. One of the things that they talked about was possibly programs in the future thinking about either mandatorily or in a mandatory way or voluntarily decreasing the number of residency spots. That is a thought that's out there that ACEP and AAEM are considering. Now, you can't make anybody do something like that, so that's another story altogether. How to do that? It would require a lot of creative thinking and problem solving. And that's a controversial thing because not a lot of people don't want that. They don't want emergency medicine spots also to be decreased, right? The other thing that people have talked about is the expansion of scope of emergency medicine. So can we move into other areas of expertise and specialty that, for example, anesthesia did with pain? And can we expand where emergency physicians can go and expand opportunities for us? The other ideas were thinking a little bit more about the RRC or the ACGME and thinking about the requirements for some of our programs out there. Could those requirements be made a little more stringently, perhaps, just to make sure that these programs have adequate numbers, adequate supervision, specifically looking at the ratio between the attending staff and the resident staff to make sure that everybody is adequately supervised. Finally, there's also, I'd be remiss if I didn't mention this. Again, very controversial topics in the next coming years, but you'll start to hear more about this. Many emergency physicians are interested in some form of collective bargaining, some kind of idea that we might be able to get together for some kind of a market power leverage, because you do have more and more contract management groups all over the country that are coming in and buying up contracts. And when you buy up those contracts, it puts them in a position of market power. So that is the E&M marketplace. These are going to be tough topics that we as a specialty are going to need to think through and talk about. I think, and this will be a very interesting discussion over the next few years within our specialty. I do want to be able to see every new grad get the job that they want. Now, 10 years ago, 20 years ago, it wasn't really that much of a thought, right? Like you could go out into the market and people would say, oh no, you're definitely going to get a job. You'll get the job you want. You'll have some choice. You'll be able to find the place in the country and the setting you're looking for, et cetera. It has become a little tighter than that. But fortunately, I'd say we have our own groups that are looking out for us, which leads me finally into the last thing, which is political advocacy. I always make a plug for this at the very end of any talk I do. I am here where I am at the Arizona House of Representatives because of the support of many of you out there as physicians, obviously my voters and my constituents, but also because so many physicians wanted someone to bring a window of our world into the legislature. There are always proposals down there at the legislature to hurt the practice of medicine and to hurt some of our specialties, or to do things that we would never think are palatable. And this kind of stuff happens all the time. There are currently only 2 physicians in the Arizona State Legislature where most of the decisions about your life and how you practice and what your salary is going to be, a lot of those decisions are made down there. And there are only 2 physicians down there, and we have to give everybody else down there, regardless of whatever your political party is, the window into the world. So you can understand what it's like to be a physician, what our world is like, and what our problems are before laws and legislation goes forward and affects our lives. I can't stress to you guys enough how important it is to join ACEP or AAEM, to stay a member of those organizations your entire life, and to contribute and to show up and to be politically engaged and active, at least know where the battle lines are and what these specialty societies are doing to fight for you as physicians. I think it's really, really important to do that. I have seen now firsthand what it's like when we have groups that are very highly engaged in society and then those that aren't. And those that aren't just get eaten for lunch. And that's why it's really important. I think a lot of us as physicians specifically, we may view politics with disdain. I understand that, or with distaste. If you look at the national media, I could understand why you came to that conclusion. But I think that also there's a lot of stuff that happens down there that doesn't make the media hype, but really goes to making the laws that affect your life. Just in the last year, I had 4 bills this year that were signed by the governor into law that I sponsored this year, and they were a point of pride for me to go through and make life better for emergency physicians. One of the ones I want to highlight is the non-retaliation bill that I put forward. I believe it was 2622 this year. It means that a group that employs an emergency physician as a third party cannot retaliate against you. That was not the law before this year. And we've done a huge thing to help emergency physicians feel safe in the jobs that they're in. There's a host of all others, but that's the one really for emergency medicine I wanted to highlight. But that wouldn't be possible without so much of the advocacy that happens through our organizations and through the Arizona Medical Association, which is just for all of us, it's the branch of the AMA. So I hope you guys ask these guys some tough questions. Get involved, stay involved. I am always willing to be a resource for you guys. And I would love it if you reached out with any questions that you have about any of this stuff. I will put my contact information in the chat. So just reach out anytime. I don't care where you are across the state. And I hope that the career you're about to have is as fulfilling for you as it has been for me. And good luck.
Awesome. Thank you so much, Dr. Shah. That was a great speech. And I think everyone here is a little more assured about what they will look for in a residency program and at the outlook of EM physicians in the future. I think we're all glad to hear that the leadership in EM is on the case already and working to improve our positions in the future. And like he was saying, in terms of political advocacy, at a more local level, our parent organization, AZCEP, which is the Arizona branch of ACEP, always has a group for EM Day on the Hill and other political advocacy events. So you should definitely sign up for their newsletters as well.